Hello everyone, Adip from Movement Science here. In this video, we will be covering the extensor mechanism of the hand. I won't be taking up this topic. My teacher, Mrs.KAVITA VISHAL, she'll be taking up this topic and she'll try to cover the whole topic in a nutshell by covering the main important points in this topic. So after this video, you'll be able to answer a 20 marker question with a very short amount of time. That is just 24 minutes of video, you'll watch it, and by watching just a 24 minutes video, the whole extensor mechanism will be covered. So sit back, relax, and just enjoy the topic.
So hello everyone, today we will be discussing extensor mechanism of the hand. So an extensor mechanism of the hand, when we discuss the extensor mechanism of hand, we are primarily interested in knowing the anatomy and function of the extensors of the wrist and hand. You have three major tendons here, the extensor digitorum communis, the extensor indicis and the extensor digiti minimi. Now the extensor indicis and the extensor digiti minimi are separate tendons for the index finger and the little finger, while the extensor digitorum communis goes on to form insertions to all four fingers. So when we talk about the extensor mechanism, we are talking about the complex interactions of the extensor digitorum communis tendon with the other tendons as well as additional structures which we will be discussing a little later. So now the extensor digitorum communis tendon divides into four slips for the index, middle, ring and the little finger, and at the level of the MCP joint it divides into three slips. The central slip of what we call as the central tendon goes on to insert to the middle phalanx, while the two tendons which are called as the lateral bands, they combine to form a conjoint tendon which inserts to the DIP joint. So you have one central tendon which inserts to the PIP joint, or basically it inserts onto the middle phalanx, okay, and then you have two tendons which go and join at the distal interphalangeal joint, and then they combine there and form a single tendon over there. Okay. So this is the basic anatomy of the extensor digitorum communis from the level of the MCP joint. So you have the extensor indicis and the extensor digiti minimi which join the tendons of the extensor digitorum. Now the functions of the extensor extensor indicis and the extensor digiti minimi is basically to give the index finger and the little finger some amount of independent extension. But usually if you look at the anatomy, this is extremely variable, and what you normally notice is that only the index finger is capable of some amount of independent extension, while the other fingers are not capable of independent extension. That means that when you try and extend the ring finger, you will notice that there is some amount of passive extension of the middle finger as well. But in the index finger, you will always notice that you have the ability to independently extend, okay, the index finger. So that is the basic anatomy of the muscles. All right. Now what is exactly this extensor mechanism? So the extensor mechanism is the complex structure which is formed beyond the level of the MCP joint by the active and the passive interconnections of the extensor digitorum communis tendon. Okay. So the extensor digitorum communis is basically joined by two components, the active component and the passive component. All right. And this active component has the extensor digitorum communis tendon itself. Okay. From now on, I will not be discussing extensor indicis and extensor digiti minimi as separate structures. We will consider it as part of the extensor digitorum because basically it joins these structures itself. So you have the active component which basically consists of the extensor digitorum communis. There are two more structures which form a part of the active component, that is the lumbricals and the interossei. So the lumbricals and interossei can also be considered as part of the active component of the extensor digitorum. So now let us look at how these lumbricals and interossei are arranged. So if you have to look at the MCP, PIP and DIP joint, The lumbricals and the interossei, basically if they are separate structures and they arise from different, for example, the interossei will arise from the metacarpal area and the lumbricals will be from the flexor digitorum profundus tendon. But just to simplify it, they pass volar to the axis of the MCP joint. Okay. So, they pass volar to the axis of the MCP joint and dorsal to the axis of the PIP and DIP joint. So, if you just look at the structure itself, you can identify that, and this would be your extensor tendon. Okay. So, your extensor tendon is passing dorsal to the MCP joint, PIP joint as well as the DIP joint, while your lumbrical and interossei are passing volar to the axis of the MCP joint and dorsal to the axis of the PIP and DIP joint. So, essentially if you have to look at their action, the extensors are at a mechanical advantageous position to produce extension at the MCP, PIP as well as the DIP, while the interossei will cause flexion at the MCP because it passes anterior to the axis of the MCP joint and passes posterior to the PIP and DIP. So, thereby it will cause extension. Alright, so you can consider interossei and lumbricals as MCP joint flexors and PIP and DIP joint extensors, while the extensor digitorum communis passes dorsally. So, it has the ability to produce extension, but there are certain things that are additionally required for the extensor digitorum to cause PIP as well as DIP extension. Now, let us look at the passive structure. Now, the passive structure basically has three structures which you all need to remember. One is the sagittal band, second is the triangular ligament, and the third is the oblique retinacular ligament. Three of these structures are extremely important for the functioning of the EDC. So, basically they are required for the extensors to function well. So, let us look at what are these structures. The first structure that I am going to talk about is the sagittal band. So, the sagittal band basically is a structure that arises from the MCP joint. Let us say it's actually starting from a structure which is called as the volar plate, and the volar plate is anterior to the MCP. All right. So, it starts anterior to the MCP, and this is the extensor tendon. All right. So, it passes anterior to the MCP, and it so this is the extensor tendon and this is the volar plate, and this would be your sagittal band. So, basically the sagittal band is a connective tissue which arises from the volar plate and then passes to connect to the extensor digitorum tendon which is here. So, now the basic function of the sagittal band is to keep the extensor tendon centered onto the PIP joint and does not allow the central tendon to slip. So, basically the central tendon is here and it is over it remains dorsal to the MP joint axis because of the sagittal band. So, this sagittal band will be there on either sides. Then you have the second particular structure which is called as the triangular ligament. The triangular ligament connects the two lateral bands of the extensor digitorum together. So, prevents these lateral bands from moving away from each other, so that the extensor force can be transmitted to the DIP. So, this is where the triangular ligament is going to be. It connects the two lateral bands together. And finally, we have the last one which is the ORL. The ORL passes anterior to the PIP joint axis and passes dorsally over the DIP joint axis. And so, it is basically volar to the axis of the PIP joint and dorsal to the axis of the DIP joint. So, that is how we can summarize the anatomy of the extensor mechanism of the hand. So, now we are going to be talking about function of the extensor mechanism. So, when we come to extensor mechanism function, you have two functions that you need to know: the extensor mechanism function at the MCP joint and the extensor mechanism function at the PIP as well as the DIP joint. So, we will begin with extensor mechanism function at the MCP joint. So, now we have already done the anatomy, and now we know that the extensor digitorum tendon passes dorsal to all these joints, right. It is going to pass dorsal to the MCP, the PIP as well as the DIP, while you have your lumbricals which are passing volar to the MCP joint, but dorsal to the PIP as well as the DIP joint. So, to better explain this, let us see how these muscles function. Now, if I contract the extensor digitorum alone, the action that I am going to get is MCP joint hyperextension. So, all of you all might wonder that we have already discussed that it passes volar, dorsal to all these joints, but still when you actively contract the muscle, you get only one joint extension, that is only MCP joint extension is possible if there is an isolated contraction of the extensor digitorum muscle. All right. Now, why that happens is because when there is an active contraction of the EDC and the MCP joint hyperextends, this creates some amount of passive tension in the flexors, that is the flexor digitorum profundus and the flexor digitorum superficialis. So, what happens because of the increasing passive tension in these muscles, the interphalangeal joints automatically will flex. So, an isolated contraction of the extensor digitorum tendon would actually cause only MCP joint hyperextension. All right. Now, let us come to the lumbricals and the introtia. Now, since the lumbrical and the introtia pass volar to the MCP joint axis and dorsal to the IP joint axis, when they contract, they are going to flex the MCP and extend the IP. So, that is quite explanatory that they are passing anterior. So, they are MCP joint flexors and they are passing posterior to the axis of the PIP and DIP. So, they automatically become extensors of the IP joint. So, we can say that the extensor digitorum is not as effective as an IP joint extensor, whereas it is more stronger than an MCP joint extensor, while the introtia and lumbricals are better positioned to cause IP extension. Now, if you want, so how can I do this action? All right, that is, how can I produce combined extension of the MCP, PIP as well as DIP. Now, for me to get a combined extension at the MCP, PIP and DIP, the extensor digitorum and the lumbricals and the introtia should function together. So, a combined action of the extensor digitorum, lumbricals as well as the introtia will give you combined extension of the MCP, interphalangeal as well as the interphalangeal joints. All right. So, what is basically happening here is when you do a combined action, the MCP joint, so introtia when it acts, it can cause MCP joint flexion, right. So, that flexor torque is kind of opposed by the extensor digitorum, because that is the stronger muscle here, and when all these muscles contract together, you will get extension at all the joints. So, you will get extension at the MCP joint, PIP joint as well as DIP joint. So, let me just summarize this again for you all. So, an isolated contraction of the extensor digitorum muscle will give you only MCP joint hyperextension, followed by flexion at the PIP and DIP, which is basically happening because of the increased passive tension in the flexor digitorum profundus and the flexor digitorum superficialis. An isolated action of the introtia will only and the lumbricals will give you MCP joint flexion as well as IP joint extension. So, but a combined action of the extensor digitorum and the lumbricals and the introtia will give you extension at all the joints. So, we can rather say that for the extensor digitorum to function as an effective IP extensor, it requires the help of the lumbricals and the introtia. So, let us imagine a situation where the lumbricals and the introtia are not there. You can imagine you come across patients where patients have ulnar nerve injury. In such cases, the extensor digitorum will not be able to extend the IP joint, because in such conditions you have a you have paralysis of the intrinsic muscles. So, what happens classically, you see the claw hand, because the extensor digitorum can function only at the MCP joint and the IP joint extensors are obviously lost because the introtia are paralyzed and you get this clawing. Okay. One additional thing that you would not normally notice in these patients is that you get clawing even at rest, because the passive tension in the extensor muscle is higher than the passive tension that is there in the flexor. So, you will get clawing, you will observe this clawing even while at rest. Okay, let us move on to the extensor function at the IP joints. Now, the extensor function at the IP joints has three main things that we need to know. The first one is the extension of the PIP joint is always followed by the extension of the DIP joint. That is, if you extend the DIP joint passively or actively, it is always followed by the extension of the DIP joint. All right. Now, let us look at how this actually happens. Now, to explain this, there are two mechanisms here. First is, I would like to take your attention to the extensor anatomy over here. So, when you say that you are extending the DIP joint, it is the central tendon that is getting activated. So, the central tendon starts extending the PIP joint, right. So, we have already seen in the anatomy that the extensor tendon is inserted to the middle phalanx and it is capable of extending the PIP joint. Now, the minute the central tendon starts extending the PIP joint, all the structures, it is going to create tension at all these structures. So, you can say that the lumbricals are also attached here. Okay. Then you have the interossea are also going to be attached and they are going to be passing here. Okay. The transverse ligament as well as the oblique retinocular ligament also gets stressed. So, when the central tendon starts extending, okay, it creates tension on the lumbricals, when as well as the interossea, which are also getting inserted over here to the extensor tendon, and this extensor force gets transmitted to the distal phalanx. All right. So, whatever action that happens because or whatever extension that happens because of the central tendon at the PIP joint gets transferred to the distal phalanx as well, because there are interconnections here, right. So, the central tendon gets activated, that activates the interossea and lumbricals which are also inserted here, and that extensor force gets transmitted to the DIP joint, thereby extending the DIP simultaneously. So, much of this connection can be explained by the action of the lumbricals and the interossea. So, it is the lumbricals and the interossea that actually helps in extending the DIP joint. There is another way to explain the same. So, the next method to explain this phenomena is by the oblique retinocular ligament. All right. So, the oblique retinocular ligament is passing volar to the axis of the PIP joint and dorsal to the axis of the DIP joint, right. So, now what happens here is that when the central tendon starts extending the PIP joint, the ORL are going to be stretched, right, because it is on the flexor aspect and then you are trying to extend, the central tendon is going to extend the DIP joint. So, what happens? This automatically creates tension here. So, what will happen? This gets transmitted to the DIP joint and thereby creating some amount of extension at the DIP joint because of the tension that is developing in the ORL. So, already it is stretched over here, it cannot simultaneously stretch at the DIP joint. So, in other words, when the central tendon starts extending the PIP, the ORL gets stressed. The tension that develops in the ORL will prevent flexion at the PIP and the DIP will automatically extend. So, continuing with the extensor mechanism function at the interphalangeal joint. So, the first mechanism that we discussed was PIP joint extension is always followed by DIP joint extension. Now, the second thing that I want to discuss here is the second mechanism. So, when we try and flex the DIP joint, automatically you can see that the PIP joint also flexes. All right. Now, what does it have to do with the extensor mechanism? One can simply explain this by saying that the muscle that is going to cause flexion of the DIP joint is the FTP tendon, right. So, the FTP tendon passes volar to the axis of the DIP joint, volar to the axis of the PIP joint. So, it is common sense that when it tries to flex the DIP joint, automatically it can also flex the PIP joint. So, let us say that when the FTP starts working at the DIP, it automatically will flex the PIP as well. But to do this, so now I am just trying to explain what is the relationship with the extensor mechanism. Now, to do this, the flexor digitorum profundus tendon actually requires the help of the extensors. Okay, so, it requires the help of the extensors. So, let us see how that happens. Now, we all know that it is the lateral bands that are going to get inserted to the DIP joint and the central tendon is inserted to the PIP joint. So, what happens when the FDP flexes the PIP? The lateral bands are going to get stretched over the DIP joint, all right. So, let me just draw it, probably you all will understand it better. Okay. So, we have the central tendon here and the lateral bands here. Now, when I start flexing this joint, it creates stretch on the lateral bands. So, when it creates stretch on the lateral bands, what will happen to the central tendon? Because this is a singular structure, when the lateral bands get stretched, they would move distally, right? It will carry the central tendon along with it, all right. So, the central tendon also migrates distally along with the lateral band. So, let me do that again. So, you flex the DIP joint. Okay, it stretches the lateral bands gets pulled over the DIP. What will happen? It will also stress, or it will also carry the central tendon along with it. Now, when it carries the central tendon along with it, it eases the tension in the central tendon, okay, or reduces the tension in the central tendon, and what happens? Automatically the PIP joint undergoes some amount of flexion because the extensors are not stressed or tensed at the PIP joint anymore. So, I will repeat that again for you all. So, when you do a flexion of the DIP joint, the lateral bands are going to get stretched, they are going to move more distally. This will also carry the central tendon, reduce tension in the central tendon and allow the FDP to flex the PIP joint as well. The last thing that I am going to be discussing is when you flex the PIP, or if you have kept the DIP flexed actively or passively, you are not able to extend the DIP joint. So, can you try doing that? If you flex the PIP, the DIP joint cannot extend, all right, it is not possible. Okay. Now, how is that happening? It is the same mechanism. So, it is quite easy if you know the previous interconnection that we have discussed. So, what happens here is when you flex the PIP joint, that is going to be done by the FDS muscle, the central tendon gets stretched. Okay. When the central tendon moves more distally, it is also going to move the lateral bands more distally. Now, when the lateral bands move more distally, what happens? It reduces the force in the lateral bands, okay, or eases the tension in the lateral bands, and automatically there will be flexion at the DIP joint, and this flexion at the DIP joint is because of reduced extensor force of the lateral bands at the DIP joint. So, basically there is migration of the central tendon. When the central tendon migrates, okay, I will just go back to the picture again. When the central tendon migrates more distally, okay, because of the flexion force that is going to be created by the FDS muscle, there is release of tension in the lateral bands and automatically the DIP joint also flexes. So, once you have kept the PIP joint in flexion, because of this reduced extensor force at the DIP joint, you are not able to extend the DIP joint. To summarize, today we spoke about the extensor mechanism of the hand. Now, the extensor mechanism of the hand has active as well as passive components. The active component of the extensor mechanism is the extensor digitorum tendon as well as the lumbricals and the interossei. The passive components includes the sagittal band, triangular ligament and the oblique retinocular ligament, the anatomy of which we have already discussed. Now, the entire mechanism, okay, is called as the dorsal digital expansion or the dorsal hood or the extensor hood. So, this entire structure, this complex structure is called as a dorsal digital expansion or the dorsal hood or the extensor hood, and all of this lies beyond the level of the MCP joint. All right. So, we have already summarized the anatomy, we have discussed where these structures lie. We also discussed the function. In the function, we spoke about what happens at the MCP joint as well as the IP joint. So, in MCP joint, how does the extensor digitorum tendon take the help of the lumbricals and the interossei? We also discussed about what happens at the PIP as well as the DIP.
So, that was your extensor mechanism in nutshell. I would really like to thank Kavita ma'am for taking up this topic and really just nailing it. And thank you guys for watching. If you like the video, share, subscribe to the channel, and thank you guys and see you in the next video.